Well, welcome to the follow-up after show, kind of a web extra for our follow-up viewers. We have Joel Strasz with us, who joined us in the body of this week's show. He's the Public Health Officer of the Bay County Health Department. This is the time of year people need to start getting flu shots.
Get your flu shot.
October is here. It's a big issue. Every year we say you got to get it early. You guys are gearing up for that. How so? And what's your message, I guess?
The first message, this is the one that always gets folks from, or prevents folk from getting a flu shot would be, you know, I got a flu shot and then the next day I got sick and I threw up. Well, the first thing what's important to note is that influenza is a respiratory illness, it's not a gastrointestinal illness. So if you're throwing up, you don't have the flu. That happens in babies and toddlers, but that's only because they usually ingest the mucus, and there's only one way out for them. But it's not a gastrointestinal illness, so that's usually norovirus or food poisoning. But with that being said, if you've had the flu, that is, you're out for 4 to 14 days, flat on your back. You get usually about 102, 103 fever, and body aches, but it's a respiratory illness, and it's pretty serious. And actually, the flu kills more people per year than car accidents and overdoses.
So don't put it off.
Don't put
it's
it off.
October. Get it done. That'll last to the whole winter at least.
And there's a variety of different places. It used to be, you know, your doctor or the health department were the only places you had to go. Well, thankfully, you can get a flu shot in just about every big name pharmacy now. Some of them are offering free flu shots, but most of them, it's a covered benefit. If you've got health insurance, whether it's Medicaid or Blue Cross Blue Shield, it's a covered benefit. Your insurance company wants you to get a flu shot too because they want to keep you healthy.
Absolutely. And the kind of flu shot we're getting, I think that's been a controversy over the years. Did they get it right? You know, I still got sick. Do you think they're getting better at trying to figure it out, the kind of flu shot you're going to get?
They're getting better and better at predicting. But, you know, really it's not so much of a guessing game and did we get it right this year. It's a matter of, is a particular strain of the virus going to mutate and how is that going to spread throughout the populace? And one of the easiest ways it can spread is through school. So, you know, we encourage parents to get their children vaccinated. Not a lot of parents want to do that, but there are a fair number and growing number that are. But, you know, it's not, the flu vaccine isn't just for senior citizens either. It's really for the entire population.
Right. The other public health issue I want to talk about before you go is opioids. That continues to be a huge issue. It continues to take a lot of lives around the country and right here in our backyard. Are there some new things that that are helping you sort of get the word out? Issues, things that, any updates that you can
Well,
tell us
it's
about?
really changed the way that we look at addiction in a public health setting, and that's a great thing. We don't look at addiction as a person's moral failing. And more of the population is seeing this as a medical illness and a treatable medical illness. But it's also, for us in public health, it's really changing the way that we do surveillance around the issue. The way that we found out initially was we actually started to see more and more people dying of overdoses. And it wasn't until the autopsies were completed and the toxicology reports were completed, usually 2 months after the death, that we started to see more and more of these numbers. That has really forced us to try to get real-time data. So we're actually starting to create databases of overdoses and really enhance our use of toxicology across the board in all death cases. Because one of the things that is suspected, and I'm sure that we'll see, is we have a fair number of suicides here in the Great Lakes Bay region. And it's been theorized and partially vindicated that a lot of these suicides probably have a substance abuse component to it as well. So these folks that are dealing with substance abuse issue, in addition to depression and hopelessness, don't see a way out. So it's important, you know, if we see this, if we can try to prevent it as soon as possible. And treating that substance abuse issue will help prevent the suicide later on.
It's an important issue. You're right. If we can intervene early, if we can find out the causes, sort of the prevention early, get to them early, we can save some lives down the road.
Absolutely.
Good. Hey, thanks for coming in. Always great to have you. I'll have you on again.
All right, thank you.
And thank you for joining us for the follow-up after show.